The school breakfast program reduces hunger and improves health in children. Many families cannot afford to provide nutritious meals every day. Participation in the school breakfast program has been linked to improved overall dietary quality, a lower probability of weight gain and obesity, fewer incidences of tardiness, absenteeism, and disciplinary problems, and fewer visits to the school nurse. There is also evidence that better meal quality helps increase participation in the program. Any public school, nonprofit private school, or residential child care institution can participate in the federal school breakfast program. Any student attending a school offering the program can receive a breakfast meal. Depending on family income, the federal government reimburses the school a certain portion of each meal distributed. Schools are considered severe need if at least 40% of the lunches served during the second preceding school year were free or reduced price. Children who are categorically eligible for free school meals can be certified without submitting a school meal application. School districts are required to directly certify children through data matching of SNAP records with school enrollment lists. Some categorically eligible children are missed through these processes and are still certified by submitting an application. The Supplemental Nutrition Assistance Program is an important part of the federal nutrition assistance strategy. The program serves low-income people of diverse backgrounds and circumstances. Every dollar in new SNAP benefits results in $1.80 in total economic activity. The American Community Survey shows SNAP participants for the Congressional District 7 in New Jersey. As you can see, 33% of households receiving SNAP benefits are living below the poverty status, while 3.8% of households living below the poverty status are not receiving benefits that they qualify for. Also notice the wage gap between the median income of households receiving benefits and those that do not. In order to expand the program, advocates, policymakers, state agencies, and school districts are working together to improve participation in nutrition. During the 2013-2014 school year, schools continued to implement new nutrition standards outlined in the Healthy, Hunger-Free Kids Act of 2010. This act requires the USDA to make nutritional improvements in federally funded school meals. The new standards may seem challenging for some schools, but the USDA is working hard to help schools implement these changes, including giving extra reimbursements to cover increased costs. Schools that meet the new standards receive an additional 6 cents per meal reimbursement. Despite the success, it is also possible that the new nutrition standards are resulting in dramatically reduced school meal participation. To make sure calories were spread properly throughout food groups, the standards put a limit on grain, protein, and salt. Food without salt, students were accustomed to, tasted bland and unappetizing. Many students refused to take the increased fruit and vegetable servings, so the schools could not collect their reimbursements. Even though participation in the program decreased for students with household incomes high enough to afford it, many students do not have this luxury. The school nutrition standards provide healthier meals to students, many of whom obtain half of their daily calories through the school meal program. The New Jersey program participation had the highest increase in the country. Two important strategies towards expansion are offering meals to all students for free and the Breakfast After the Bell program. Using the traditional school breakfast program methods, school staffs need to collect and process different meal fees according to the students' income levels. By offering meals for free and using the provision 2, significant administrative costs can be saved. The community eligibility provision also provides administrative savings by eliminating the school meal application process so that models such as breakfast before the bell can be implemented. Reimbursements are calculated by multiplying the percentage of identified students by the free reimbursement rate, which is 1.6. The school breakfast program can sometimes make students using the program feel marginalized by the perception that only low-income students eat breakfast at school. This can be changed by including breakfast as part of the school day so that everyone can participate without added attention. Distributing meals after the start of the school day also makes eating more accessible and convenient, so participation increases. New Jersey successfully promoted the Breakfast After the Bell program using the Food for Thought School Breakfast campaign. This campaign was led by advocates and a statewide steering committee. Now an estimated 13.5 million more breakfasts are being served over the course of the school year. Despite this progress, many low-income children still are not receiving breakfast at school. A huge problem is that too many districts are only serving breakfast before school, and children are often prevented from getting to school in time to receive their meals. These schools are called school breakfast underachievers that spend resources to operate a school breakfast program but do not serve enough children to receive enough federal reimbursements. Hungry students struggle to concentrate, but providing breakfast enables students to learn without this obstacle. Distributing breakfast during school hours is the best way to involve as many children in the program as possible. New Jersey spends billions of state and local tax dollars every year on public education. With more children participating in the program, this money will be utilized for meal reimbursement and children will be better fed.